Hi, I'm Richard Train.
And I'm Hogan Allen, and we're the co-founders of Get Results Marketing and Business Coaching.
Now, last night on our Blog Talk Radio show, The Whole Tooth, we really had a fantastic guest.
Yes.
You know, they're all great, but you know, they're all different in their own way. And Shirley Gutkowski, who is one of the top hygiene speakers in the country and consultants in the country, was our guest last night. We had a great conversation with her.
Yep, very edgy topic. Not everybody likes it, but that's what we're about. We're about controversy sometimes, so we like to stir it up. So
don't shy away from that.
Her topic was working on production is not a crime. And like always, I mean, there's tons and tons of great points. We got to narrow them down for everybody.
Got to boil it down to the top five. So the first one really is, you know, most hygienists practice at different levels. And so when you think about that, it's almost like you need to compensate them appropriately according to how they produce. So, for example, of a chat and polish hygienist.
Yep, that's a great example. You know, I mean, it is. You have the lady who's sitting at the, who knows everything about a family and when birthdays are and knows all those kind of things, and they're wonderful for the practice.
Nothing wrong with that. However,
the hygienist in the next room might be cranking out 3 people at the same time.
Right, because much better at being able to upsell and handle all of the other types of things that you do to be able to go along with the treatment plans and everything else.
I agree. Next point. How do you avoid the overselling? I mean, when you become production, you have the tendency to almost oversell everything going on because your money's tied to it.
Well, not necessarily, but that is the perception.
Yeah, absolutely. So what Shirley really recommended was you treat every patient like your mother.
Exactly.
Great way of putting it. So, focus on what the patient, what their wants and their needs actually are.
Right. Third point, how do you know what's the right percentage as far as some sort of a production-based compensation for you? And you really have to work that out with what is comfortable for you, the hygienist, or you, the doctor, and kind of find your level.
I agree. For the doctors, I think this is great. I do, personally. Because I think that changing a hygienist to the production method is a great motivator. You have a lot of hygienists who are just wonderful at what they do, but they're not producing as much as the doctor would like. So I think this is just a great way of maybe transitioning that person maybe into a commission structure of some sort, or
a bonus structure.
A
base plus a bonus or something.
Exactly.
Right. Fifth point, if you change to the production method, make sure that your percentage is enough to make up for the other things that you might be losing, such as if you're already paying them benefits.
Yep. Or vacation time, you might not get as much if you change this way because your percentage should be higher.
Well, something's going to have to give.
Yes.
And
give and take.
Right. Exactly. So in closing, make sure you join us next week on The Whole Tooth, Tuesday, October 19th at 8 o'clock p.m. Eastern Time. And we're very lucky to have Carrie Cady with Oral Biotech, Carrie Free, who is a hygienist, and she is also the VP of Sales. And her topic is patient care beyond drill and fill. Great topic, and she's going to be very interesting.
Chairside. I like it.
I like it.
Getting chairside. I like it. So, like always, if you have any questions or comments about the show or any of the products that we have to offer, please feel free to give us a call at 800-275-2350. Visit us online at getresultsfordentist.com. And make sure, like I said, I keep coming back to it because it is Breast Cancer Awareness Month. Make sure you go and you check out smilepink.com. So, for Richard, myself, Hogan, have a great week.
Thank you very much.